Now, after urine is formed in the kidneys, it will be delivered to this tubular structure which is called the ureter. Now, the wall of the ureter is only composed of 3 layers of tissues. So from the innermost, you should be able to identify the epithelium lining the mucosa of the ureter. What type of epithelium is that?
Transitional.
It looks like stratified. However, there is no gradual decrease of the size of the nucleus. In a true stratified squamous epithelium, as the cells ascend the superficial layer, there will be gradual decrease in the size of their nuclei. So dito, maski na sa taas na yung cells, malalaki pa rin ang nucleus. That epithelium is called transitional. Pag napuno ng ihi ang lumen ng ureter, pag mayroong dumaan na urine, this epithelium will become thicker or thinner? Thinner. So, mayroong stretchability property ang transitional epithelium. And then, how do you call this connective tissue immediately underneath the mucosa? The epithelium, I'm sorry? The lamina propria. And then after the lamina propria is the muscularis externa, and then the outermost layer is called adventitia, because the ureters are embedded in the retroperitoneum. So mucosa composed of 2 tissues, lamina propria, and then the epithelium, transitional, muscularis externa, and then the outermost is adventitia. After the ureter, there is temporary storage of urine that will occur in the urinary bladder. Mayroon pa rin 3 layers of tissues ang urinary bladder, similar with that of the ureter. What type of epithelium is lining the mucosa? Transitional. And then how do you call this layer of connective tissue? Lamina propria. Immediately external to the lamina propria. Okay, as you can notice, there is no distinct arrangement of the smooth muscle fibers. Collectively, the muscle fibers are called by what name? May specific name ng smooth muscle fibers in the urinary bladder. Name starts with letter D. Detrusor muscles. And then the outermost layer is called who says adventitia? Okay, very good. How do you call that type of epithelium? Mesothelium. So that this should be the serosa or adventitia? Serosa. These cells are absent in adventitia. Kasi, kita nyo na yung urinary bladder sa anatomy? Tadabar ninyo?
Not yet.
Wala pa. Mayroong free surface. Ang urinary bladder, mayroon link surface na naka-attach sa pelvic wall. Yung naka-attach sa pelvic wall, it will be lined externally by adventitia. The portion na mayroong free surface, serosa. So that's it for the histology of the organs composing the urinary tract, urinary system. So next meeting, the coverage of our quiz will be this chapter. Walang slide na ureter. Ngayon, this coming Monday, wala?
Chinese holiday, no? Chinese New Year.
Ah, New Year. Salamat sa Chinese. New Year. Classic. Okay.
Ang ureter, meron siyang goblet cells so nakapulong.
Mga umbrella cells yung makita.
Kasi sa ibang doktor, ang gamit nila ng term is goblet cells.
Wala mang mucus secretion sa urine. Sa ito. Stick to what is said sa Junquera. Kasi yung halos kami lahat, dyan lang kami kumukuha ng question. Okay, you may now view your slides. Gusto ninyo ang quiz natin next meeting, practical quiz.
Waitin lang daw.
Ayan yun na ano, to make you more familiar with your slides pagdating ng ano, practical exam. Kasi your practical exam accounts for 2/3 of your laboratory grade. Kung mga quizzes natin, mga quizzes natin, 1/3 lang yan. Mas maganda pag na-master ninyo ang slides ninyo in preparation for the practical exam. Anyway, it's your choice.
Moving na multiple choice.
Isa, kapoy mag-iingat, kapoy mag-check.